This is the SAFE Coalition, Confronting Our Crisis. The purpose of this series of programs is to keep our focus, our attention on the very real crisis of substance abuse disorder. We can't get numbed by the statistics and normalize this epidemic in any way. I'm Dr. Ann Bergen, co-host of this series with Jim Derrick, who is the president of SAFE and the creator of this series of programs. Jim was kind enough to include me because he knows that I'm concerned as an educator about what we can be doing in our schools, really focusing on the prevention aspect. So we welcome you here today. Our very special guest today is Dale Kurtz, a Franklin resident, who is the Veteran Service Advocate for Norfolk County. And since our veterans are really being impacted by substance abuse disorder, along with so many other people across the country today, we thought it was very, very important for Dale to be here and help shed light on this issue as it impacts those who are dedicating their lives, who have dedicated their lives in service to our country. So we want to welcome you here today, and thank you for coming. I know you're really busy, but to take time out and help us with this. Will you tell us a little bit about what that role is? What does it mean when you say Veteran Service Advocate? What is it exactly that you do?
Well, first, thank you, Ann and Jim, for inviting me to be here today. This is an important issue, and it's one that we're fighting every day to try to ensure that those who've served our country are well served by us. Yeah. Mm-hmm. So what does it mean to be a Veteran Service Advocate? I'm still trying to figure that out. I work with as the Veteran Service Advocate, I work with the other VSOs, Veteran Service Officers, within the towns, 28 cities and towns within Norfolk County. I've also had the privilege of working in the Veterans Treatment Court in Dedham, which I'll talk a little bit more about later.
Yeah.
A great experience, a great opportunity to help those young men and women who run into difficulties correct their actions and their sort of focus and vision of their life and see them become very productive. So that's been a great experience. I'm also very fortunate, as you know, to be the Veteran Service Officer here in Franklin and in Avon. So not only do I have that higher level view of working with the VSOs and what they do for treatment and higher, more strategic activities, but also boots on the ground, tactical, working with vets individually here in town and in Avon.
Mm-hmm. And you're also a veteran. I saw you at the and a West Point graduate. Is that
yes,
true? Yes.
I am a West Point graduate, and I am a veteran. Served in the United States Army. Very proud of that.
Thank you for your service.
Thank you
very much.
Thank you. So were you just for the purposes of this program, obviously, will you tell us about the scope of the problem, the substance abuse disorder issue among veterans, so people get a sense of the scope of that and how big the problem is?
Sure. And I'll start with talking about the scope of that illness or addiction in the military. And I believe people would be very surprised to find that the rate of addiction to illicit drugs, heroin-based drugs, opioid-type drugs, is much less in the military than it is in civilian life.
Active duty.
Active duty. Mm-hmm. About less than 3% of
so
military.
Active duty. Okay,
active duty.
I didn't know that.
Why? Well, we do have random drug testing in the military.
Oh, okay.
And we also carry pretty strong punishment. That if you are convicted of an opioid issue, you can be discharged with a non-honorable discharge, which takes away all the benefits you may have ever hoped to have had by serving in our Army or
Dale, is that
military.
limited to opioids, or does that
any drug abuse?
Any illicit drug?
Any illicit drug abuse.
Understood.
Drinking, alcohol use in the military is higher than it is in civilian average. Mm-hmm. There are a lot of reasons for that. None of them good, but the actual alcoholism in the military is about on par with civilian life. So what happens is people are out doing their work for 2 or 3 months at a time, come back in base, and they have a party, sort of blowing off steam. So there is a bit of alcohol use, and we consider that abuse. But as far as alcoholism, it's a bit less. Prescription abuse in the military is, again, on par now with civilian world. 10 years ago, it was higher. But the military across the board, whether Navy, Air Force, Army, Marines being treated by Navy hospitals, really curtailed the amount of prescription drugs that they would provide. because they recognized that we were creating an issue.
And how long ago did that happen, Dale?
That was about 8 to 10 years ago.
Okay, so they were ahead of the trend. We just had
Absolutely.
legislation passed, for 72-day prescriptions.
Right.
You were way ahead of that.
Well, we also were way ahead on creating the problem. And that we
Interesting.
had, as we talked a little bit ago, in prior wars, you look at World War II to Vietnam, many more people in Vietnam survived horrendous injuries because of the great medical care and advancements we had. But we then had to treat them with pain medication. That changed from Vietnam to OIF, OEF, our current Gulf wars. That was about a tenfold change. We have so many more people surviving. But the injuries, we all see the situations on TV, whether it's Wounded Warriors or another advertisement or show where you see someone who's lost a limb. That takes a lot of care and treatment, and the pain and suffering that they go through is much higher, and there are a greater number of people going through that. So we did overtreat. We realized, again, like we do in so many things in society and in our lives, we overreacted to a situation, found a solution we thought would work, realized maybe it was working, but created other problems. So we've backed off that and tried to control it.
I was just curious because when you read too about the chronic pain that people have lived, Vietnam vets and the chronic pain, I was just curious. It seems to then have led to people who live with that chronic pain for so long. Ultimately, the suicide rate is what is the suicide rate among vets? Is it? This is just a side question that I was curious about.
Some numbers are still at 20, 22. I've seen numbers as low as 17 per day. So a percent, I don't have percentage. I count on the real numbers.
Sure.
And that's high. And the preponderance still are Vietnam-era vets.
Yeah.
And there it's a number of things. It's the fact that many of them who are homeless, and there are still the greatest preponderance of homeless veterans are still Vietnam-era vets.
It's really sad.
Isn't it awful?
We weren't well received when we came home.
Yeah.
And during our time, during that transition, it was difficult. It was difficult to get a job, difficult to reassociate with family. We didn't have the counseling that we do today to help our troops reassociate with family and with society. So they were alienated. And you become homeless, you have a higher preponderance to be addicted to an opioid, to any drug.
Any drug, alcohol, yeah.
And unfortunately, opioids are so available these days.
Sure.
We had a death this past year of a Vietnam-era vet, suicide by opioid. We call it a suicide because he OD'd, and that's self-induced. So it's tough. It's tough.
Yeah, that is. You talked a little bit about the Vietnam era vets and their difficulty assimilating back into society, and the lights that are going off in my head are for current veterans, or any veteran for that matter, with such a high level of pride in what they're doing and the training that they go through. What role does stigma play? Does it play an increased role, do you think, in veterans resisting getting help for substance use disorder or admitting that they have the problem?
That's a good question. Yeah.
Absolutely. In the work that I do one-on-one with vets, one of the biggest challenges I have is to explain to a vet, you're not asking for help. You've earned this.
Right.
When we're in the military, I don't care if you're in the Navy, Air Force, Coast Guard, Marines, Army, what you're taught is take care of yourself and take care of the person on your left and right. By doing that, you create a strong unit bond. So when someone comes to me and they have something they need some help with, they're very reluctant to reach out and ask for help. Why? Because I need to take care of myself. That's what I was trained to do. I need to take care of the person on my left, take care of the person on my right. I don't need somebody taking care of me. That's the challenge.
So that's self-sufficiency.
Absolutely, and it's it is what makes our military so strong.
And I can imagine that expands out. I'm a parent, and I can imagine that must expand out to the family as well, because you have an enormous amount of pride, and I imagine many other emotions while your loved one's deployed in a theater, and when they come back to see them struggling with substance use disorder, it's got to be a roundabout, very, very difficult stigma to break, and it must be very, very difficult for families to deal with as well.
More often than not, the veteran or active duty will hide their issue from the family. The family knows something's not right, but the vet or, again, active duty or our soldier will go to great lengths to hide any issues. The only way the family finds out is either by finding them in a bad situation or because they are picked up and arrested for either possession or paraphernalia or whatever. So vets are pretty good at hiding things, unfortunately, from their family.
But I was just going to say that's why this is so important too, is the more conversations and getting this stuff out and to say that this isn't, it's so important. It doesn't mean you don't have courage to come forward and get help because you're helping your family and you're it's real. But it is important. That's such a good, important.
But it's also the family.
Yeah.
The family knows something's not right. Reach out. Reach out, and you know what? It's better to ask for some help and not need it because it's a different issue than it is to close your eyes, let it persist, and end up in a very tragic situation.
Yeah. I just want to take this opportunity to remind viewers that we have a support group locally in Franklin, but also there are 21 chapters throughout the state. And it's learn2cope.org is the website where you can find meetings. The meeting in Franklin locally is every Monday evening at the First Unitarian Universalist Church at 7 p.m. It goes until 9 p.m. It's completely confidential. It's for family members and loved ones who suffer from substance use disorder. And if you're a veteran's family, please come out and utilize this resource. You will find a warm welcome and many, many resources toward getting help for yourself and for your loved one.
And I need to look at my cheat sheet, but we also have a veterans crisis line.
Terrific.
If a family member or a veteran is in crisis, call 800-273-8255.
And we'll put that out there on...
That number will be on our website and also be on the screen.
There's someone live there who will take the call.
And what type of service would somebody expect, Dale, when they do call that number?
Good question.
It depends what the situation is. If it's immediate need, they will have someone dispatched to help make sure that we don't end up in tragedy. We can refer them to counseling. We don't hang up the phone unless we have an action plan in place. And it's continual. We also have 7 vet centers here in Massachusetts where any combat veteran from OIF or OEF wars, the Gulf Wars, can go to a vet center. It doesn't matter if they have a dishonorable discharge or an honorable discharge. They can go and receive treatment, as can their family members. Again, you walk in, you're going to be taken care of. We have great resources.
And do you have actual inpatient rehabilitation for veterans, Dale, and where might those be located?
We do. Both Brockton and Bedford Hospital have inpatient treatment. We also work with other, I guess we'd call them .org organizations, charitable organizations that provide support to us. And that's back, I mentioned the Veterans Court before. I became very involved with some of those treatment centers and how we would help people. The time I was so active in the court when I was there every week. I'm not there every week now. I just can't be. But I probably worked with 45 to 50 different veterans coming through the system. And we had some failures, some very sad failures. But we had a ton of successes. And people who, the first day you see them, it's like, this one's going to be tough. We don't think they're going to make it through the program. 18, 19 months later, this person has a job, is contributing to society, is proud of who they are, and has a family back together. That's it's emotional.
That'll give you the
Yes.
goosebumps
Yeah.
right
It
there,
does.
and that's the nature of this illness. This illness doesn't discriminate, and it is an illness. And I'm curious, do veterans have a sense? Has the VA educated the population that this is an illness? Do they feel it's a moral failing? Have they caught on to that?
There's constant counseling, both in the military and at VA centers. The VA docs and nurses, the staff are trained to observe people and determine whether or not there may be an issue. It's high on Secretary McDonald's list of action items.
Fantastic.
We can't have someone walk out the door thinking that they may have a problem. I mean, that's his goal. If we think there's a problem, let's address it now. We don't want to read about it in the newspaper.
I was going to ask too that I was not aware of all the services that the veterans organization have in place. It's incredible. What would you see now when you look in an objective look? Where are the needs? What else needs to be happening that isn't, that you can point us to?
Housing. I mean, bottom line, when I have vets come to me in need of housing support, there isn't any in our area. Metro West, we're sort of like that forgotten land. I can send someone up to Framingham or Worcester or into Boston or to Brockton, but vets don't want to leave their families, don't want to leave their communities to go live somewhere else. So that is really a big issue, and not just for vets who have who's suffering with addiction, but just veteran families in general. It's tough. Housing, to me, is number one, because if a veteran's homeless, they're most probably using addiction also. There's a strong correlation.
So
that's how they cope with the day.
Yeah, that's something in talking with like legislators and stuff like that. Another one of those questions about housing that we need to keep bringing to the forefront. Huh?
Most definitely, and this our coalition's goal is to address all constituencies. We know now, and I've been involved with this for almost 2 years now, directly, and to find that seniors aren't immune.
No.
There just is nobody that's immune to this. And as you mentioned before, the families left in the wake, the children and everybody else are sick and need treatment as well. But I'm very proud that you're here in Franklin. I'm very excited about continuing a relationship so that we can hopefully find ways to assist the veterans that are living among us and their families get treatment and help and know that they're supported and cared for.
Absolutely. I would add one other item of the needs.
Oh, yeah.
That's mental health care.
Oh,
Again, high correlation between homelessness, mental health, and addiction. We just do not have enough support. Even though we have a lot, it's not enough. For the VA, the vet centers at the VA, having enough social workers, psychologists available to be able to treat them. And also, you have to have that key to get in the door. That's a tough thing at the VA. You can get into a vet center, but maybe not into the VA without having registered and gone through a number of steps to become eligible for medical care.
So it's more cumbersome than it ought to be still?
Well, it's improved, but yes. I mean, I have vets who come to see me, and we fill out the paperwork, and their categories 1 through 8. They end up in a 7 or an 8 because of their income. Well, just because you have a little bit of money doesn't mean that you're not having a problem.
Sure. What type of insurance coverage for this type of thing? What type of out-of-pocket expense, if any, would a veteran experience that was receiving treatment for alcoholism or substance use disorder?
If they're in the VA system or if they're being treated through the VA, their expense is zero or maybe a small copay, but almost nothing. It's great. It's just getting the access.
Can you just explain that part to me? So certain veterans can get,
Yes.
but then tell me again why many wouldn't be able to. What prevents them is
it's access and it's availability. If we had all
so it's
21,
sort of triage. In other words, they take the most severe, and then you've got
not necessarily the most severe. It's those who are eligible based upon a set of criteria that we have. When did you serve? If you did not serve during a wartime, you may be lower on the list. If you did not serve in combat, you may be lower on the list. If you have if you have a pension that's being paid, a compensation from the VA, you'll go higher on the list. It may be that you are being paid for hearing loss, but you have access, versus someone who earns a little bit of money, isn't eligible because of that, and maybe they didn't serve in combat, but had some other situations. They may be precluded from seeking treatment at the VA.
Do you have a sense as to what the wait time might be? I mean, just a general sense? That we hear horror stories in the news, and I'm just wondering.
We've always been pretty good. I would say about 12, 15 months ago, I was hearing some rumblings of some challenges getting in to see psychologists or psychiatrists at the VA here locally. Yeah. I haven't heard that recently, but we can always use more access.
Sure.
A wait time isn't extraordinary.
Okay.
And again, if it's an emergent need, we get someone in right away.
Got it.
Well, maybe that's, thinking out loud, that may be one of the roles that the coalition plays,
Yes.
is making mental health care readily accessible to people that find themselves in that gap area.
Right.
And we'd like to work with you on that.
I would love that.
Because that's something that, it's like substance use disorder, which is a brain disease. Any mental health illness is not something you want to wait in line for. It's not like a fracture that's in a splint that's waiting to get a cast on it. This can be can go from a relatively seemingly manageable thing to, I don't want treatment and I'm just going to go out overnight.
You break your wrist. You go to the doctor.
Yep.
You get a cast on it.
Yep.
And you go back and continue to get the treatment until it's healed.
Right.
Mental health is the same way. You have a break. Okay. It's nothing to be ashamed about. It happens. Go get the treatment and continue the treatment until you're healed. It may take a long, long time, but it took a long, long time to develop
That's
that
right.
situation.
That's
So
right.
take advantage of it. Don't be ashamed. And that's one thing that we in society are a little bit better about, but we need to continue to improve. Don't get all whacked out because someone's getting help. Be whacked out about the person that you're preventing from getting help because you have some view of of who they are, what they are.
Right.
We've been talking, Jim, about issues that affect, we talk at our crisis, community crisis. When you look at the schools, we're looking at issues around mental health. We're seeing these issues surfacing when kids are very young. So it's an issue. It's an issue, not just in Franklin, certainly, but across the country, that we've got to find a way as a community to do more about providing mental health services. And when we're looking at budgets, when we're looking at FinCom, when we're looking at town council, that we're saying, you know what, this is a huge problem across the spectrum. It's for kids, it's for veterans, it's for, right? I mean, isn't that a huge thing that we've got to really aggressively address as a community?
Absolutely. It's literally heartbreaking. I have a son. I'm very proud of my son, who who was inspired to become hopefully part of the solution and go out to Washington, D.C. and become part of the Veterans Administration. His entry point to that was a returning vet from Afghanistan. But it's heartbreaking to me to hear the stories anecdotally and seeing in your eyes the desperation for those that are forgotten by the system. And I agree with you. I mean, this is our call to action. And I think it's high time that we respond to this, both as a community and when the government's ready. Hopefully, we'll all step up together.
That's right.
And hope people in Franklin realize we do have homeless people in Franklin. We do have people with mental illness in Franklin who, because of that, are homeless, and trying to get them help is very, very, very challenging.
Right.
That's, and you spoke to, again, from an educator perspective, what we were talking about, the impact on deployment, on reintegration, on families, on kids in our schools. And we have to find a way to make sure we identify those kids and find ways we support them, again, through counseling services and in our schools. And again, it does speak to us coming together, right?
It sure does.
All of us.
It sure does.
And so we want to thank you very much for being part of this and bringing this issue out to the community and making sure, again, like you were saying, the stigma, we've got to just get rid of it and say this is everybody's issue. We're all in this together. And if you want to reiterate the resources.
Yes, absolutely. Thank you, Dale. Thank you very much. And thank you for watching the SAFE Coalition Confronting Our Crisis. Please remember you're not alone. we stand ready to help. We can be found on the internet at safecoalitionma.com. We're on Facebook and Twitter as well. Or if you need urgent help, please call our resource line at 508-488-8155. And thanks very much for watching.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.